Yeah, okay.
Yeah, now we are online. Yeah.
Okay. So,
Yeah, you can start, Mr.
good evening, participants and doctors. My name is Nishant, and I'm a regional medical advisor from Shield Healthcare. And I welcome you all to participate in this webinar on our digital platform, which is Shield Connect. And today our topic is on vaginal microbiome in fertility, which will be presented by our special guest speaker, Dr.Ambuja. And first of all, let me introduce you with our digital platform, that is the Shield Connect. So you can get an idea that what is this page about. So this is our Shield Connect web page, shieldconnect.in, where you can find various kinds of blogs for providing you all the information and knowledge sharing of
Sorry
various
to interrupt,
topics.
Nishant. That page is not visible. Only slide is visible. Shield Connect page is not visible.
Okay, 1 minute. Okay,
Yeah,
is
now
it
it's
visible?
yes, yes.
Sorry for interruptions. So participants, this is the webinar page, and this is the shieldconnect.in, where we have various blogs, webinars, awareness programs. So in blogs, you can see all the knowledge sharing information regarding various topics, where all the renowned doctors write the blogs and we share it with you. Then we have another page regarding the awareness program, the like immune booster and PCOS awareness. So in immune booster, right now we are promoting a new product, that is Rudimin New, which will be much helpful in this pandemic situation. And then this is the PCOS awareness page, where you can find all the uh, videos related to PCOS topics, and it is available in all the regional language like Tamil, Hindi, Malayalam. Then we have one more page, the special day pages, like Hypertension Day, Mother's Day, GDM special, Women Day special. So you can find various videos regarding the days and the topics connected with those days. And we have our leader page, where you can find all the key opinion leaders who share the webinars with us. And this is the webinar page, where you can find all the upcoming webinars and past webinar details. So you can connect us on shieldconnect.in, which is having all the informations. So let me start with the webinar of today. So today webinar is on vaginal microbiome in fertility, and our special guest speaker is Dr. Ambuja Choranu. I welcome you, ma'am. And let me give a brief intro about our speaker. So, ma'am is currently president in Indian Menopause Society. Ma'am was a professor and HOD in obstetrics and gynecology department in Osmania Medical College. And ma'am is also visiting professor in Savita University, Chennai. Ma'am was All India Vice President as well as President in Family Planning Association of India. Ma'am was also a part as a faculty and resource person in National Board of Examinations. Ma'am was a treasurer in Society for Obstetrics Medicine India. Ma'am was also peer review in Journal of Obstetric and Gynecology India, Journal of Midlife Health. Ma'am was also an examiner in for UG and PG field to various medical universities, and ma'am also was an author to many national and international publications and books. So while I start this webinar, participants, you can post your questions in the comment section so we can have a Q&A session after the webinar. So I welcome you, ma'am, and I will help you this session, and you can start with the webinar.
Thank you, Nisha, for your kind introduction.
Thank you.
And good afternoon, everybody. First of all, I thank Venkateshan for inviting me to be the speaker of the day, and to all the audience. Just wait, let me share my slides. Yeah. Today's session, vaginal microbiome in infertility. I just want to introduce the subject. Thing is, always we'll talk about the microbiomes in view of the gut microbiomes or respiratory microbiomes or the urinary tract microbiomes or the vaginal discharge method. This is very new that it is connected to the fertility problems. See, if you analyze the causes of infertility, even today, 40% of the causes are unknown. So probably this may get into the unknown causes. So definitely once it is proved and randomized control trials still are not being done, a lot of evidences are there. But to prove ourselves in the medical fraternity, we need to have the randomized control studies. So I hope it is going to come, because lot many studies, maybe about since 5 years, within these 5 years, lot many studies are there. So if it proves, it's going to be a really very good hallmark in infertility. So first of all, we should know what is microbiome. First of all, they are microscopic living organisms in body. They are either bacteria, virus, and it can be fungus. Many of them, they are healthy, and some are harmful to the body. There are so many microbiomes in the body. Suppose if you take a gut, there are 40 trillion living organisms in the large intestines and especially in the cecum. But if you take a body cell as it is only 30 million body cells are there. That means the humans are more bacterial than the cells that are present. See, that's the fact it is there. Means there are so many organisms in the body. Only thing is, when these organisms, whether they become pathologic or it allows the pathologic organisms to come, then it becomes a problem for us. They are the microbiomes. So suppose if we take the vagina is full of organisms. The homeostasis in the vagina is maintained, all of us know it is because of the Lactobacilli that is present in the reproductive age group. So this is a balance between good bacteria and harmful bacteria. Normally, I already told you, in the normal vaginal flora, plenty of Lactobacilli are present. It maintains the acidic environment and protects from the colonization of the opportunistic infections. See, this is again dependent on the amount of estrogens that are present in the body. Immediately after the childbirth, that is in the neonatal period up to 1 week, the maternal estrogens are carried to the baby. That is why it is an acidic environment that is there, and the Lactobacilli will be present. But as it is, until the girl attains menarche, the estrogens are not there. That is why it is a alkaline environment that will be present, prone for infections. Vaginal infections will be more. But that time, intercourse, vaginal intercourse is also another culprit to produce the infections, because there will not be any sexual activities in the childhood. That is why not many cases of the infections will be present. The same thing, when the reproductive age starts, the estrogens start increasing, and it is in a cyclic manner. See how the waves of the sea will be there, it will go up and down like that. As the estrogen level increases, there is ovulation, and just before the menstruation, the level of estrogens and progesterones will come down. So whenever there is any deficiency of estrogens is present, like just before the menstruation, immediately after the menstruation, these people are prone for infections, and so the colonization of the opportunistic infections will take place. And these lactobacilli, acting on the squamous epithelium of the vagina, produces the lactic acid. That is why the pH of the reproductive age vagina will be acidic. It protects against the invading pathogens. Hello, am I audible, Venkateshan? Hello?
Yes, madam.
Yes, ma'am. Yes, ma'am.
Yeah, because there is no response, please. I was thinking just I'm talking when there is no audio.
No, ma'am. It's like.
Yeah, this is how vagina is protected from the pathogens in a normal course of events. But otherwise, all the women must be suffering with the infection throughout if the lactobacillus is not present. Lactobacilli also produced bacteriocins, which have the potential to inhibit bacterial growth and physically prevent other bacteria onto the squamous epithelial cells. This is the one we have to understand. Not only it produces acidity, it prevents other organisms to go in the acidic medium in the vagina. These two are the protective mechanisms that are present. When this protective mechanism is not there, they are going to have the infections. That's what is the main gist of it, what we should understand. So, dysbiosis means it is an imbalance between healthy and unhealthy microbiomes. Recent evidence suggests a possible association between alteration of vaginal microbes and seminal microbiota and infertility. This is what is the thing. All the time we were talking, when this acidity comes down, they are prone for infections. We never thought in terms of the infertility, but now it is proved beyond doubt that seminal microbiota and alterations in the vaginal microbiota, if it is present, there leads to the infertility. An abnormal vaginal microbiota has been associated with a poor outcome in patients undergoing the infertility, in vitro fertilization, what it is being observed. So what are the organisms that are there normally, which is coming harmful? I told you the normal organisms are the lactobacilli, and when other organisms infect, it is the bacterial vaginosis that is called. What is this vaginosis? Any organism anywhere in the body infects, we call it as the nitis, that is the infection. Vaginitis, we call it as candidal vaginitis, trichomonas vaginitis. Why especially for bacterial vaginosis we are calling this? This is because we don't see any inflammation. The bacterial vaginosis, it affects. Clinically, there will not be much of symptoms that will be present. On examination, we don't see inflammation. That is why we will never think of this as a problem in infertility. We don't give treatment for this. That's what we should understand. That is why whenever we start with the infertility treatment, we should treat the vaginal infections first. Otherwise, it will not get treated. That's why what we do is, even when you are doing IUI or a patient comes for the infertility, first we do the vaginal examinations, see whether there is any copious discharge or anything is present. Most of the times tentatively we give a course of tinidazole or metronidazole for all these patients. Then we start the treatment for infertility. Many a times it is a successful one. So again to repeat, why do we call it as a bacterial vaginosis? It is because there is no inflammation. It is only the involvement of the vagina with this bacteria specific. It's a clinical condition characterized by shift in vaginal microbiota away from Lactobacillus towards more diverse bacterial species, including facultative anaerobes. So, production of volatile amines by the new bacterial microbiota will be present. Usually, when Lactobacilli is present, they will produce more of H2O2, that is hydrogen peroxide. That is why it becomes an acidic media. But here, instead of that, amines are produced by the new microbiota. That is why the vaginal pH will become more than 4.5. And the major bacteria detected in women with bacterial vaginosis are Gardnerella vaginalis, Mycoplasma hominis, Ureaplasma urolyticum, as well as Mobilincus and Megasphere and Clostridium species. Many organisms are present without harming the human beings as long as the Lactobacillus is dominant. When it is dominant, these are all like pathogens, they will intrude. That's what like a Indo-China war. Our people, when army is very efficient, Chinese people will not come in. If it is not efficient, they'll try to intrude into our camp, especially when it is very cold or it is raining like that, they will intrude into our cells. Altered vaginal microbiota and dysbiosis. And bacterial vaginosis represents a complex change in the vaginal microbiota characterized by reduction in concentrations of the normally dominant hydrogen peroxide producing lactobacilli and an increase in concentration of other organisms, especially anaerobic gram-negative rods. If anybody can understand this, finish. We know everything about the vaginal infections. Now it is very easy to treat. How are we going to diagnose this condition? That's what is, I told you, there will not be any inflammation. How do we diagnose this condition? Clinically, there will be copious serous discharge that is translated from the vaginal mucosa and exfoliated squamous cells will be present. So, how do we see this? When we take the pap smear, we can see the clue cells that will be there. These are the clue cells, means the cells, the normal, this is the epithelial cells that are present, and bacteria will get adhered to the epithelial cells. This is what is the clue cell. Always, most of the times you must be seeing, most of the audience, all of you are the specialists in treating the patients. What happens, you know, the dreaded problem to treat in gynecology is the vaginal infections. They will go round and round the doctors, so many places, but still they will not be treated. Once you give the treatment, it will come down again it starts. Why it happens? That if we know, then we know the recurrent reason for the recurrence of the infection. There is something called the biofilm. Increasing evidence suggests that Gardnerella vaginalis is the key player in the pathogenesis of bacterial vaginosis, and the development of biofilm may be an essential component of this process. In addition to the gradual overgrowth of the resident anaerobic vaginal microbiome, the cohesive form of Gardnerella vaginalis adheres to the vaginal epithelium and then becomes static there, to which other species adhere. They are called the clue cells. In the presence of a biofilm may make it difficult to eradicate bacterial vaginosis, and it increases the rate of recurrence. So until now, this is what I said. Every time they go from one doctor to the other, and the same prescription will be given, maybe different changes in the names. The superficial infection gets treated, but actually this is the biofilm that is formed on the epithelial cells that is present like that only. That is when the recurrence of infection, it is more common in these cases. Apart from the clinical findings, what are the things you will see? The lactobacilli microflora is disturbed and pH is very, very important. Put a pH and see whether it is acidic or alkaline, and yellowish discharge will be present, and Staphylococcus aureus and Escherichia coli also can be present. But in the bacterial vaginosis, there are no. The main thing what you see is the clue cells if you take a gram stain. And second thing is, if you put potassium hydroxide 10%, if you take a smear on a slide and put a 10% potassium hydroxide drop, you will see the fishy odor will be present. That is the malodorous discharge. If it is present, it is because of the bacterial vaginosis. I already told you there are certain factors that modify the vaginal microbiota. One is the infections. Second is, again, the age, already I explained you. And especially in the pregnancy, it lowers the concentration of mycoplasma and ureaplasma and decreases the pH. That is why all the infections will come. And smoking is another problem. Of not, it's not a major problem in our country, but still it is becoming more nowadays. And cancers. These are all the conditions where vaginal infections can occur. Microorganisms are present not only in the vagina, but also in the upper female reproductive system, including the ovaries, fallopian tubes, and the uterus. This is what is new for us. We thought, see, this is the upper reproductive tract, and this is the lower reproductive tract. Here is the cervix. Are you able to see my arrow? Hello, are you able to see my arrow?
Yes, ma'am.
Yeah. See, this is the cervical plug that will be present. So the vaginal infections that are present in the vagina will not get into the uterus because of the cervical plug, which acts as a guard. But other microbiota are present in the uterus, fallopian tube, and in the peritoneal fluid. That again is a causative factor for abnormal microbiota that is present. Usually, uterus is sterile because of the cervical mucus that is present. Recent research has identified a bacterial microbiome in the vagina, endometrium, and in the fallopian tubes. Presence of Lactobacillus species seems to be associated with good IVF outcome. This already I told you. The presence of other specific microbes besides Lactobacillus is associated with implantation failures and miscarriage rates. Semen also harbors a specific microbiome existing of mainly anaerobic bacteria, including Lactobacillus. All will be present, but other organisms also will be present. That is why the balance becomes hostile. And during spontaneous conception, the microbial content of sperm might enter the uterine cavity and most likely interacts with the endometrial environment, including local microbiota. This is what happens. Usually with the intercourse, the semen also has got the microbiota that will enter into the uterine cavity and causes havoc. This is the reason why, unless it is treated, the IVF outcome or a normal pregnancy outcome also is disastrous. There is an article from the Spain that is written very clearly. The lack or diminished lactobacillus presence is associated with bacterial vaginosis, dysbiosis, sexual transmitted infections, severe adverse gynecological and obstetric outcomes as genital infection, inflammation, and preterm birth. Microbiome is also related to infertility, and this knowledge opens a new understanding for future clinical treatments. Here again, what I want to insist and say is bacterial vaginosis is not a sexually transmitted disease, though it comes after, especially after the intercourse. And evidence says before menarche it is not present because there is no sexual intercourse. But still, the CDC has not decided that it is a sexually transmitted disease. What are the consequences of altered vaginal microbiota? I already said, but it is to insist and say that increased susceptibility for sexually transmitted diseases, including human papillomavirus and HIV, the preterm labor, infertility, failure of embryo implantation in vitro fertilization, recurrent pregnancy loss, and cancer risk. These are all the major things that can occur. Different species of Lactobacilli have different immunological properties. Lactobacilli cryptapus plays a role in protection against pathogens. The presence of Lactobacillus in us can cause altered gene expression, including defense against bacteriophages, and is associated with the presence of bacterial vaginosis. This is a new thing that is there. We never thought that genetic transmission, it acts on the genes and it is a immunosuppressant also. The beneficial effect of the presence of lactobacillus within a local community or reproductive outcome could be explained by several mechanisms, which the production of lactic acid is probably the most important. There are so many reasons, but they are all still not proved as the genetic cause or the therapeutic cause, everything. But what is proved? It is the lactobacillus producing the acidic environment, which is preventing other organisms to come up, and so it is a good lactobacillus is a good organism. Additional production of lactic acid by the local diversity of lactobacilli, the receptivity and supportive invasion and acceptance of the hatching and developing blastocyst. So even for the development of the blastocyst and invasion of the parasite, sperm into the ovum, for all these things, lactobacilli helps. The rapidly dividing blastocyst depends heavily on aerobic glycolysis, which is characterized by the formation of the lactate. All of us know this. Lactobacillus produces the lactate, and so that is why it is the lactolysis that happens and acidic period is there. Glycolysis is the process that takes place, and that's important even for cellular membranes, nucleotides, and antioxidation. If antioxidation is not there, the free radicals are produced which are harmful to the developing embryo. During implantation, the levels of available oxygen are extremely low, and increasingly embryonic consumption of glucose, and with it is the production of lactate. The resulting lactate-rich microenvironment of blastocyst is supposed to enable endometrial breakdown, facilitate invasion of modules. The local immune response prevents rejection of semi-allogenic embryo. Here, the action of immunity plays a part. Because of the presence of lactobacilli, it prevents rejection of embryo implantation into the endometrium. Now we know how lactobacilli are important in the vagina, how to have the interaction with the semen that is present, and how it enters into the endometrium. Because of this immunomodulation that acts, it helps in implantation because of the microenvironment of the blastocyst that is there. It helps in invasion, and then it prevents rejection of the embryo. So these are all the advantages of having the lactobacilli. So for any reason, if lactobacilli are not present, it affects the fertility problems, and there comes the implantation failures, IVF rejection, or even if they conceive also, increased rate of the abortions, spontaneous abortions are very, very common. Next comes is, among other players involved in the microbial community are viruses. Until now, we talked about the bacteria, including bacteriophages, which make up the viron. Bacteriophages are microbial viruses that can infect bacteria, interfere with their metabolism, kill the infected microbes, and allow for horizontal gene transfer activity, influencing the bacterial composition of local microbiota. See, I already told you the natural commensals in the vagina. It can be fungus, it can be virus, it can be bacteria. I told you all these things are suppressed because of the dominance of the lactobacillus. When lactobacillus, which is influenced again by the estrogens, where the estrogen deficiency states will be present, then these are all the things that will dominate. I told you, if the domination like Gardnerella, if it is present, if it becomes more, how it appears and how it is going to interfere with all the pathological things that happens. Then comes the virus. Virus will not directly act. It acts as a bacteriophage, which make up a virome. So bacteriophages are microbial viruses that can infect bacteria, interferes with their metabolism, kill the infected microbes, and allow for horizontal gene transfer, influencing the bacterial composition of local microbiota. Again, what is going to happen here? The acidic media is going to come down and other pathogens will grow. Several mechanisms describing bacteriophage-driven dysbiosis has been proposed, including either killing commensal bacteria by lytic infection, using internalized phages by killing competing bacteria with integration of phages of DNA and bacterial genome to enhance bacterial function. This is what is the thing that is even NIH. This is the paper produced in 2014, where it said, colonizing the transfer catheter tip with lactobacillus crispans at the time of embryo transfer may increase the rate of implantation and live birth rate while decreasing the rate of infection. In addition, there is some evidence that a progesterone-resistant endometrium might increase the risk of an abnormal vaginal microbiome. So, again, vaginal microbiome is very, very important. It influences the infertility and assisted reproductive technology. The vaginal microbiome as a predictor for outcome of in vitro fertilization with or without intracytoplasmic sperm injection. There is a prospective study that is being done. It says microbiome profiling with the use of interspace profiling technique enables stratification of the chance of becoming pregnant prior to the start of IVF or ICSI treatment. So, the presence of microbiomes is the lactobacillus in the vagina, in the endometrium and fallopian tube. When these things are present, it increases the success rate of IVF and ICSI IUI. This is what is the gist of it. So, microbiomes are necessary. The good microbiomes, that is the lactobacillus, should be present, which helps in fertilization, and it is present in the vagina, endometrium, and fallopian tube. Not that only in the vagina, what we were previously thinking, even in the peritoneal cavity also that is present. Sometimes from the gut also it can enter into the endometrium and cause the havoc. So this is what is necessary. We should try to treat them. There is a studies there on just to say that vaginal microbiota and its relation to IVF outcomes. They have done a lot of study. That's what is produced. Can you please excuse me? I had to open one more slide. It is something, it is mismatched. Will you please excuse me? Shall I stop and start once again?
Yes, ma'am. No issue.
I will start again. Just 1 minute, please. Yeah, just now I told you, if gut microbiomes will be about 40 trillions of microbiomes will be present in the gut, and recurrence pregnancy loss is associated with the leaky gut, a novel pathogenic model of endometrial inflammation. That's again another paper producing saying that recurrent pregnancy loss also sometimes the cause for, if the gut infection is present, that is one of the causes again for the recurrent pregnancy loss. Success in IVF and microbiome, composition of the vaginal microbiome on the day of embryo transfer is important. It undergoing IVF was studied and it was found that a lower vaginal microbiota diversity, a diversity index correlated with the better live birth rate. Means if dysbiosis is less during the embryo transfer, there will be good outcome of the live birth rate will be more. So until now, what did we study? The microbiota, it can be good or healthy or unhealthy. Healthy microbiota is necessary for the proper functioning of the normal physiological events, either to prevent local infections to occur or to carry out the fertility also. That's very important. Microbiomes are present not only in the vagina, it will be present in the uterus, fallopian tubes, and in the peritoneal cavity. All these things, if dysbiosis occurs, are going to affect the fertilized ovum before fertilization, during fertilization, and after fertilization also it is going to affect. If it is fertilized, it will not allow the implantation to take place in the endometrium. It will not allow it to grow, or even if the pregnancy occurs, there will be increased miscarriage rates, and there will be preterm delivery, intrauterine growth retardation. All these havocs can occur because of the dysbiosis that takes place. If we know all these things, maybe because of the genetic form, or it can be immunomodulation can occur. Whatever may be the reason, this is the dysbiosis. How are we going to manage this? That is the one which is necessary for most of the practicing gynecologists. They are not bothered about all these things. They just want to know, yes, you say there is Gardnerella infections present, clues also present. What if? What is going to happen to me? How am I going to treat my patient? That's what is very, very important. Not the they will see, yes, this is present. We will say, this is the bacterial vaginosis. I'll agree with you. What is that? How am I going to treat? Yes, it is very simple treating. And treatment, there are so many reasons, but usually metronidazole is the best treatment. 400 milligrams 2 times a day for 7 days. That's the blanket treatment as we read from the MBBS days. 400 milligrams 2 times a day. I don't know why they wrote it as 500 here. It is 400 milligrams 2 times a day for 7 days. That's the blanket treatment. But you know, it was so, anybody takes metronidazole, they will understand how difficult to take that one. The first dose itself is vomiting starts. Nobody wants to continue with the second dose. That is why, thank God, and thank to the people who invented tindazole. That again, tindazole, they say you can give 2 grams at a time or 1 gram at a time. I don't believe in that. Because again, it is very nauseating, even if you take it on the full stomach also. And hyperacidity is another problem. So usually it is good to take 300 milligrams orally 2 times a day for 7 days for convenient purpose. Suppose if the patient is not compliance with your treatment, you can give 2 grams. If you give 2 grams, she will not come back to you again saying that what type of treatment it is. I am not able to bear difference. So better to give 7 days treatment instead of giving. Along with that, what I advise you is to give some antiemetics for the patient. Very comfortable they are. And then you use either metronidazole cream or clindamycin cream intravaginal at bedtime for 7 days also you can use. These are all the things. Better if you are going to treat the infertility, examine the patient. If there is any, you see, I already told you, bacterial vaginosis, how it is. We can't see any inflammation or anything. It is only the copious vaginal discharge will be present, and it is a false smelling. Many a times they complain, we have smell after the intercourse. That's the first thing they will tell. So when you examine, there will not be anything at all. So, but if it is the complaint like that, and if the patient comes for infertility treatment, please give 1 course of either tinidazole or metronidazole. Either you can give the vaginal application or not, but oral also is quite good, along with antiemetics. Definitely they will get treatment 80% of the cases. But you know, already I told you, the biofilm that is formed in the case of the bacterial vaginosis, sometimes the recurrence rate will be there, but needs to be repeated again because it's not an antibiotic, no resistance will be formed. There is no harm in repeating the treatment. Screening and treatment for the asymptomatic patients is not recommended in asymptomatic persons. A sexual partner may change the vaginal flora. Female partners of women with bacterial vaginosis should be examined and treated if bacterial vaginosis is present. Don't need to treat male partners because they don't get bacterial vaginosis and they don't transmit it. Screen and treat prior to surgical abortion or hysterectomy. This is what I told you. As a routine, we do give tinidazole 1 day before the surgery. That's what we do it as a routine. Even now, either for the abortion or for the hysterectomy, when we are taking thing, for everybody as a routine, we give metronidazole. Though even though they say without symptoms you don't treat, but most of the times no. Reproductive age women, when they have the intercourse, it's better to treat instead of treating at a later stage. Probiotics containing lactobacillus used over a long period. It's an alternative to antibiotics, particularly within the context of high infection or recurrence rate, you can give it. Possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota in the pre and periconceptional period. So this is good, even if there is no infection that is seen also, you give probiotics because that is the one which is going to, if there is an infection, you treat with the metronidazole or retronidazole. If there is no infection, if you think that is the vaginal pH has become alkaline, treat with the probiotics. What is the probiotics and what are the prebiotics? We should know that, isn't it? According to the World Health Organization, probiotics are defined as live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. That's what is the probiotic. So what are the characteristics of the potential probiotic? This is production of antimicrobial substances to human intestinal cells will be present. It is a human origin. That's very important. Acid and bile stability is there, means when it will not be digested with the acid, it goes to the large intestines, because I told you to get absorbed, it should be in the small intestines and in the gut. In the large intestines, lot of microbiomes will be present. So it needs to pass the gastric acidity and reach the intestines to get the proper action. Clinically validated and documented health effect is there. That is why we need to use the probiotic. To repeat again, the definition of probiotics as it is given by the World Health Organization, it is the live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. That's what is the probiotic. What is prebiotic? Prebiotics are compounds in food that induce the growth or activity of beneficial microorganisms. So, combined prebiotics and postbiotics are the symbiotics. So, prebiotics, they stimulate the growth and reproduction of only useful microflora, improve the work of the digestive system, they stimulate peristalsis, suppress the reproduction of the intestines of pathogenic bacteria, and reduce the formation of gases, removes excess mucus from the walls of the small intestines, and maintains the pH. That is why not giving only either probiotic or prebiotic, you should give both combined. The vaginal probiotics rationale to develop is clearly established protective role of Lactobacilli. Application can be topical. That is why the vaginal probiotics are preferred. Rationale of probiotic using Lactobacilli. Develop a non-chemotherapeutic probiotic therapy using Lactobacilli to maintain Lactobacilli dominated vaginal flora, inserted directly into the vagina. Oral preparations also are available. I think the Shield has got the oral preparation. Used in women for urogenital infections during infection, but also for healthy women to maintain normal flora. I told you already, the Lactobacilli or the microbiomes are present in the intestines, in the urinary tract, and genital tract and the skin. These are all the places where these organisms are present. And so any of the things we can use the probiotics. Lactobacilli probiotics can be used over a long period without adverse effects, unlike antibiotics. That's what is the difference between the antibiotic and probiotic. Antibiotics, for a long time, we cannot use it because the resistance is another problem. But probiotics, we can use for a long time. And antibiotics, we don't use it in a healthy women, but here, this has got the advantage of using for the healthy women. The antibiotics damage commensal microflora. It can increase the occurrence of resistant strains, can have adverse side effects, but probiotics they don't have any of these things. It can be used for a long time. It can be used as adjuvants to antibiotics to restore the commensal microflora. So, probiotics and prebiotics are the ideal treatment. But only thing is, see, we Indians, we need to use our system of management is entirely different compared to the developed countries or the Americans or the Australians. You see, whenever people come from America, even a Bisleri water, if they take also, they can't digest. They start having the diarrhea. Even my daughter, when she came from America, she was telling, Mommy, brinjals are very tasty here. There it is not tasty. Why it is like that? See here, the growth of the brinjal is in a circumstance where all the E. coli and all enter into the brinjal. That's why they taste more. There it is very sterile. That is why their guts are so sterile. A little infection also they develop more of infection. Ours, the resistant gut, resistant vagina, everything is resistant for us. That is why the probiotics which we are going to use, it should be Indian made, not the foreign made. Then only it gives a better outcome. So it provides Indian genome specific strains, vaginal specific strains. Maximum colony forming units is 10 billion per cubic FU will be present. So that's what is the advantage which you should use it as the Indian preparation. That is the native origin. Products with strains of Western origin, which may not have the same benefit to the patient. That's what I told you. It is now widely accepted that native strains will have better efficacy on the local population. Products should have the advantage that all the strains are of native origin with clinical study and safety validated in Indian populations in establishing efficacy. Excuse me. So these are the Lactobacilli that are Indian made. Treating bacterial vaginosis increases the pregnancy rate. To conclude, I think, is it clear for you all? Any questions, please? I will answer at a later date. There is definite relationship between the reproductive tract microbiome for infertility and outcome of ART cycles. Presence of bacterial vaginosis has poor pregnancy rate in ART cycles. Lactobacillus predominance in the reproductive tract has good pregnancy outcome either without or with ART cycles. Next generation sequencing techniques for the uterine microbiome is better than conventional cultures. Of course, we don't do much of culture in diagnosis of the bacterial vaginosis because most of it is a clinical diagnosis. Cultures won't yield much results and it takes long time, and second is it is expensive. That is why that when they have seen specificity and sensitivity is quite high when they do the clinical examination itself. That is why unless it is a research purpose, we don't do the cultures. The clinical examination is quite good enough to diagnose the bacterial vaginosis. Apart from that, of course, everywhere you go, it is the lifestyle changes, exercise, And these are all the social reforms, stopping the smoking, drinking, all these things are there. We tell both for male and female. So that's what, always don't think that vaginal infections are causing sexually transmitted diseases, this and that. It is one of the main points even for fertility. This is very, very important to treat the vaginal infection before starting with the fertility treatment, even for the normal person. Thank you very much to the audience for the patience listening. If there are any questions, I am ready to answer. Thank you very much.
Thank you, ma'am, for giving this valuable information. So I have noted down a few questions. One of a doctor is asking from the IVF related question that the doctor prescribed the probiotics when patient comes for the initial screening and continued in the first trimester. Is there any evidence to suggest that probiotic helps in the outcome of pregnancy?
See, usually before starting pregnancy, you have to treat the vaginal infections. There's no need to continue probiotics if there is no indication during pregnancy, not necessary. Because it's not the probiotics which are going to take care of the pregnancy. It is the estrogens and progesterones and other hormones that are necessary, not the probiotics.
And the second question is, are probiotics safe for use during pregnancy and lactation? And if it is safe, then what will be the treatment duration for the probiotics?
It is safe. Nothing proved that it is unsafe. As I told you, no, it's not an antibiotic. Even if you continue in the normal person for a long time also, it's not going to happen. But one thing all as a doctors, we all should remember, no treatment without indication. Only when it is necessary, use it, especially when the patient is pregnant. And not necessary to use because there are so many unknown factors that will affect the fetus and the mother. That's the reason why we don't give anything in the first trimester unless it is essential to save the life of the mother, not even the baby. To save the life of the mother, we give it. Then where is the need to give unnecessarily? Just like that, because it is available probiotics you want to give. No, not necessary to give.
And one more question is that, does gut microbiome affect the vaginal microbiome?
See, gut microbiome, it is like that. Gut leaks if it is present. It can come to the peritoneal microbiome. From there, it can affect the endometrium. But as it is, it will not affect the thing. Only one thing we should remember is the perineal microbiomes that will be present. E. coli and other staphylococcal infections will be present in the perineum. They are not pathogens in the gut. But when they enter into the vagina, they are the pathogens. That is why we advise everybody to clean the perineum from urethra and backwards, from front to the back, not from back to the front, so that the E. coli is a commensals that will be present and they become pathogens once they enter into the vagina. That's what is very important. Lot of E. coli will be present in the anus because of the close proximity of the vagina and the anus. It's quite possible to get the infections very easily if they don't clean properly. That's what is the thing. We insist for the repeated infections if anybody comes. The vaginal hygiene, perineal hygiene, and perineal wash. That's what is very important. And actually, I think Shield people, they have got the perineal wash that is there. And that's really good if they use the perineal wash. It not only protects it and it prevents the organisms to enter into the vagina.
Yes, ma'am. And is there any difference in the effect when probiotics are taken through vaginal route and oral route?
Practically no difference. Practically no difference. But you know what happens? The bacterial vaginosis is the thing where there is a lot of water infections. It may be messy for them. Unless, like vaginal progestogens, when the doctor insists, especially for the case of infertility, most of the people, they don't like to use for a longer period vaginal tablets. It is irritating and messy to them. And both are same. Still, I have not seen the randomized control trials stating that the vaginal route is much better than the oral route. Maybe the patient's preference, they want oral route. We are still continuing with the oral because no harm anywhere.
Okay, ma'am. And one last question is there that whether probiotics can be given in combination with antibiotics for vaginal infection treatment?
Yeah, that's what I told you. No, it can be given along with the
Yes.
antibiotics. Not that you should not give it. See, antibiotics need not be prescribed without indication. But probiotics can be given along with the antibiotics, without antibiotics also.
Okay. So thank you so much for your precious time giving us on this digital platform. And I cannot find any more questions. So one of the viewer has said that the presentation was excellent.
Thank you. Who is that? What is the name of the viewer?
Dr. Asha Agarwal.
Asha Agarwal. Okay, very good. And thank you all the audience for the patient listening.
So thank you, ma'am, for providing
And
this
thanks
information.
to Shield Organics for giving me the opportunity to present.
Thank you, ma'am. And I also thank to all our team members who help us to conduct this session, our marketing team and IT team as well. So thank you, ma'am, for your time being.
Thank you.
Thank you very much, madam.
Venkateshan, thank you.
Thanks a lot. Thank you very much indeed, madam.